Now, the Health Union Caucus has expressed its support for the $1.6 billion Kenya-US Health Cooperation Framework, saying the deal marks a historic turning point, moving the country away from the unpredictable cycles of donor-led aid towards sustainable government-to-government partnership that prioritizes the dignity of the Kenyan health workers and the security of the Kenyan patients. Elizabeth Atieno with the details.
On December 4th, 2025, the governments of Kenya and the United States signed a landmark health cooperation framework, with the U.S. committing 208 billion Kenya shillings to strengthen Kenya's health sector. The agreement aims to modernize medical equipment, ensure timely supply of essential commodities, strengthen the health workforce, and expand coverage under the Social Health Authority, SHA.
I assure you that every shilling and every dollar will be spent efficiently, effectively, and accountably.
But barely 6 days later, the deal was challenged in court. The Consumer Federation of Kenya, COFEK, and Busia Senator Okiya Omtata moved to block its implementation, arguing the agreement was entered into without parliamentary oversight, public participation, or a clear fiscal impact assessment.
What guarantee do we have that we are not opening up Kenya to be a laboratory of guinea pigs for experiments on various things?
On December 19th, the court, through Justice Chacha Mwita, issued conservatory orders stopping the Ministries of Foreign Affairs, Health, the National Treasury, and the Attorney General from acting on the deal, pending determination of the petition, citing serious constitutional questions.
And so, in February, we shall go back to slug it out.
A day after the ruling, the Health Unions Caucus publicly backed the US-Kenya health deal, calling for dialogue between the government and petitioners.
So that we can have an amicable way of resolving this, because on the other side, there are patients who are suffering and there are health workers who are unsure about their livelihoods going forward.
But as unions, we've made a decision that we're also going to file under certificate of urgency to the courts on Monday to ask the courts that there's life of patient that is in danger with this particular court order.
The union says they have reviewed the data sharing agreement and found it compliant with the Data Protection Act of 2019 and the Digital Health Act of 2023.
Before, the data people are talking about were in the hands of the NGOs, and the government was not in control of any data. And therefore, if we are talking about data protection, then we believe that a government-to-government deal is going to give the government of Kenya power over the data that comes from healthcare services.
However, the caucus remains divided. The Kenya Union of Nutritionists and Dietetics has strongly opposed the agreement, raising concerns over data use and questioning how the US government stands to benefit.
The reason why we oppose this is lack of participation from healthcare professionals and key stakeholders in health. You cannot come and say you want our data to be real-time present to US government when we who work in health have not been informed in the procedures and modality.
The deal introduces a government-to-government funding model, replacing donor-led arrangements. Key state systems including SHA, KEMSA, IFMIS, the Ministry of Health, the Digital Health Agency, and KNPHI are set to receive direct funding. But the shift raises concerns about future role of non-governmental organizations, even as unions argue the model offers a path to health sector self-reliance.
Caucus applauds the strategic shift to fund the Kenya state institutions directly rather than through the NGOs, eliminates fund lost through administrative process, thereby supporting more services where they are needed most.
Uncertainty also clouds the fate of health workers. More than 28,000 workers under HIV, TB, and malaria programs were affected by recent U.S. funding cuts. The new framework provides for the absorption of 13,800 workers by 2028, leaving questions over the remaining 15,000.
The Ministry of Health and the Public Service Commission should come up with a framework to ensure that also the other 15,000 are accommodated, because if that does not happen, then we'll still have shortage under those programs.
Our healthcare workers were being employed under contract, and they have been in contract for 15 years. This deal is going to bring an end to insecurity contractual terms.
Kenya is also expected to fully take up US-funded health commodities and personnel by 2031. Health unions are now calling for strong audit systems to prevent corruption and ensure funds serve their intended purpose. The government, on its part, has committed to increasing domestic health spending by $850 million over the 5 years of the agreement. Elizabeth Atieno, TV 47.